you'll see in the clinic also, they'll have some pen and they'll go tick, 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 tick all the time. Pills are not a substitute for skills. Yeah, I feel we look at it from the Western thing because we are all influenced by the Western environment, right? Whether it's diseases, whether it's clothes, whether it's movies, etc. So people think that.
So it's more a human thing than a
Yes, definitely a human thing.
Hello and welcome to the first episode of Attention Deficit Hyper Desi. I'm Coach Ankita Jagtiani Dadachanji. I work with adults who have been diagnosed with ADHD. I am a fellow ADHD and also a POSH consultant. I'm based out of Mumbai, and the purpose of starting this podcast in India is because we wanted to have real conversations and help all of you listening get more and more clarity on what ADHD really is, whether it's the diagnosis, whether it's the medication, whether it's tools and strategies, or how it acts up in relationships. So everything ADHD from experts just for you. So today we have Dr. Pervin Dadachanji. Thank you so much for being here. Dr. Pervin is a practicing psychiatrist with a special interest in child and adolescent psychiatry. She's been in private practice for over 30 years. You've also written a book on parenting.
Yes, that's right, Ankita.
Recipes for parenting, and also consults with Umeed Child Development Center. So thank you very, very much for being here today.
Thank you very much, Ankita, for having me.
So we're very excited on our first episode to learn about ADHD and medication, how it works, and also in the Indian context. So before we jump into the topic, can we hear a little about you? How did you get into this field of psychiatry?
God, that's quite a long story. I'll shorten it to say that when I started with my medical degree, I've always wanted to do pediatrics. And then when I did my pediatrics posting, I had this little boy who I had got very attached to. I used to see him every day. And then one fine day when I went to the ward and I asked, "Where's Sachin?" somebody told me that he had died. And I think I spent that whole day howling and saying that there's no way I can do pediatrics. And then my next posting was psychiatry. And I loved it because I loved the fact that even if it was one illness, it was never, everyone's manifestations were very different. So I said, well, this is what I want to do. And as they say, the rest is history.
That's really beautiful. And what made you have a special interest in working with children?
I think I used that pediatric bit, right? I wanted to do pediatrics, but since I couldn't do general pediatrics, I probably thought that I'll do my adult psychiatry and then I'll do my little pediatric part of it. And of course, I have to say that the space which I love working with is adolescents and young adults. That's my absolute favorite space to work with now.
But we know that you get many, many requests and you end up working with a lot of adults also, especially with ADHD.
Do. And I think because I've been practicing for 30 years, I think I see my ADHD kids who have become adults now. So that also happens.
That's really So we see that over the years ADHD has really increased, or at least the diagnosis, the testing has increased. What is your view on ADHD in India today, and how is it different from what it was 10, 15 years ago?
I think the main thing is awareness. I think that people are more aware. I don't think that ADHD has increased per se. It probably, if you do a real proper study, you'll find that the numbers are the same. But the awareness has increased. Earlier, a kid would be called that, he's naughty and he's that, and that would be it. Now, when parents realize that a child is naughty or a child is not able to focus, they may think, because they are aware of that there is something called ADHD, they may get the child tested.
So do you still hear a lot of labels like lazy, or my kid has some problem?
Dumb.
Oh wow, okay. but they're doing okay. So is there really a big problem? Like what are the different kind of stories or labels that you have, parents and
So, well,
adults?
I think it's been, it can range from, as you say, lazy to dumb to is a really smart kid but is not able to perform. Or, I mean, I've had horrible things which school teachers and all have also said about children with ADHD, that, oh, this kid sucks my blood, and horrible things. I think that, I mean, as a rule, I think labeling is wrong, whatever it may be. Even a label like a good boy is as bad as saying a bad boy. Labeling doesn't really focus on the issue at hand. It just focuses on the whole person, which I think doesn't really give you the essence of the person.
So it's more personal then rather than
yeah. That, like, instead of saying lazy boy, it could be that, you need to, I think if you put your mind to it, you could study better. That would be better than saying you're a lazy kid.
Because ADHD generally has a lot of, individuals with ADHD generally have a lot of self-worth issues. So you feel just change in language is something that can help.
That can help. And it's not children, no? Then they become adults with self-worth issues also. I mean, and that is a continuous thing that I'm seeing. Whether it is kids who I have seen or even adults who I have seen, that their self-worth issues continue over the years.
So this is such an interesting topic. So we've just gone right into it. Should we just take a step back and see what ADHD really means?
So, in a very basic way, there are three things in attention deficit hyperactivity disorder. And first of all, just wanted to clarify that ADHD, ADD is used interchangeably.
Okay.
But psychiatrically, our diagnosis is ADHD with a predominant inattention presentation or a predominant hyperactivity presentation. But now that is very medical. Basically, three things. Attention issues, hyperactivity issues, and impulsiveness. These are the three things which make up basically ADHD. And you cannot say that, oh, my child doesn't focus well, so he has ADHD. It's a whole system that there are these 9 criteria for inattention, and there are these 9 criteria for hyperactivity stroke impulsivity. So you have to fulfill at least 5 of each or separately to have a disorder. So you can't just say, oh, he has a concentration problem, he has ADHD.
Right.
Or what I see right now, a lot of kids, oh, I can't focus, doctor, so I have ADHD.
So you get a lot of people coming with self-diagnosis.
Absolutely. Lots, and now more. I think COVID made it more, probably because they were sitting at home and doing nothing. So let me check whether I have a mental health issue or whatever. And a lot of them do that and come to me. It's lovely because sometimes you can, you are something which the school may have missed out, you can get because the child feels that he may have that. But of course, a lot of kids also overdiagnose themselves.
And how?
Or even adults. I mean, I shouldn't say only children. Even adults overdiagnose themselves. So the important thing to know is that as an adult, you cannot be ADHD in your 20s. You have to have had ADHD as a kid to be able to warrant a diagnosis of ADHD. So if someone says that I have a focus issue in the last 2 years, the chances are that it's something else and not ADD.
And so about 80% of individuals with ADHD in their adulthood also have some other comorbidities. What would those other comorbidities look like? So
usually for adults, anxiety, depression, substance use, these are the 3 major things. I see a lot of ADHD with anxiety and depression because I think perhaps substance use is something I don't do a lot of. So they mainly come with anxiety or depression, or the other way around. So if a person comes to me with that I have ADHD and we do ascertain that she has it, I would always check for anxiety and depression. Because if there is anxiety or depression, you would first treat the anxiety or the depression. It's a protocol. First treat the emotional disorders, then treat the behavioral disorders.
So what's the reason for first treating the emotional disorders?
So one of the things, and now here I'm talking medicine because
sure.
I am a doctor and that's the thing I know best. So medically, the medicines used for ADHD can cause anxiety also. So you would have to be a little concerned that especially if the person has anxiety and then you're giving him ADHD medicine, his anxiety increases. So therefore you first treat the anxiety, and once the anxiety is treated, whether it's with medication or with therapy, then you add the medication for ADHD.
So if the anxiety increases, could it also lead to more impulsivity then?
It could lead to more impulsivity, it could lead to less planning and less organization because anxiety makes you not do things properly. So yes, you would treat that. And depression also, a person is low, is depressed, doesn't feel like doing anything. One of the key points of depression is decrease in concentration. So then you need to be quite certain whether the decreased concentration is due to depression or is it due to ADHD. So every person who comes, actually even whether he's a child or an adult, I would do the comorbidity part of it. In children you would check for learning disabilities, you would check for conduct disorder, for oppositional defiant disorder, and in adults you would look at anxiety, depression. Even in kids you would look at anxiety and depression also. So these are, you definitely look at comorbidities.
So from what you've shared, I understand that children will usually come because they aren't doing so well academically or there's some behavioral issues in school. What would adults specifically, what would be some of the symptoms that they would bring?
So one of the things which I've always seen is that adults will come because they have earlier come with their kids. And then they will come and say, hey doc, my son has just he's just turned around, this medicine is magic. And I think even I have ADHD. So then we would go through the whole thing. And of course, when I have seen the kids, we always ask about heredity because there is an inheritable thing. Usually fathers have ADHD, not necessarily only them, even moms do, but fathers mainly. So that would be one of the things I used to see earlier, it was only that. But now, because ADHD in adults has become an entity in the classification. Earlier, you didn't have attention deficit hyperactivity disorder as an adult diagnosis. It's only since 2013 that it has become one. So probably people are reading more, seeing more stuff on Instagram and all, and then they come to me. Sometimes they don't even come to me with ADHD. They may come to me with anxiety and depression, and then we realize that they have ADHD. A lot of the time I've also seen right now, because of the super psychologists and therapists that we have in our city, that the therapists are catching this, that, there is definitely an ADHD component, so they would send the person to me. Some people also have relationship issues because they are not able to sustain a relationship because of their impulsiveness, because of them not meeting time commitments. Some may have work issues. So it affects your full functioning, whether it's social, whether it's work, whether it's family. So they come with several symptoms.
Do they often come and say, doc, just fix this problem for me?
Of course they do, that it just fix it. And as I say with ADHD, that it's fixable in the sense that it's controllable. It's not curable, because usually you have ADHD from the beginning of life and it continues. It just changes the way it appears. So children have more hyperactivity. The kids who have ADHD with a hyperactivity component, when they become adults, their hyperactivity reduces. They will not be running around all the time. But they will have a little fidgetiness, a little restlessness. They will have to, you'll see in the clinic also, they'll have some pen and they'll go tick, 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 tick all the time. So there is, so I always say that it is controllable, not necessarily curable.
So you had used a beautiful analogy earlier before we started shooting about diabetes.
I mean, that's my favorite one. I think it's a favorite one of all us psychiatrists, which we've probably been taught in school. I mean, in medical school. So diabetes is also a controllable disorder, which means that when you are treating the diabetes with medication, it is helping. The minute you stop the medicine, the sugars will increase. So, and of course, you do all your other things. You do your diet, you do your exercise. Those are all the ancillary things. But the main thing is that you have to keep that sugar in control. Similarly, in ADHD also, it's controllable but not curable. So you will always have your inattention issue. So when you are on the medication, you will be able to focus better, you'll be able to plan better. But when the medication is removed, the chances of this happening again are there. So that is what I would usually tell people, that this is the way we can fix it.
So it's possible, but it's just you have to live with it lifelong by controlling it.
And controlling it maybe with medication and maybe with ADHD coaching. I think skills often are very important, and I remember reading somewhere that pills are not a substitute for skills. So you need to have those skills in order to also get the medicine to work. So, like, I can get you to sit, if you don't sit at your desk and study, however much medication I give you, you're not going to be studying. So that basic skill of going to your desk and sitting there is something you need to do.
So is this a magic pill that, the word magic pill is everywhere. When it comes to ADHD, a magic pill can solve it. What are your thoughts on that?
So in some people, it seems like it's a magic pill, but not in all. There are some who have no effect with that.
Sure.
And in some, it is wonderful. So personally, I feel that medicine is your support, your scaffolding, while you make other changes in your life, whether it's sleeping on time, whether it's reducing your gadget use, whether it's your nutrition, exercise. If you do all those things, you learn how to deal with these challenges which you have, whether it's with a therapist or with an ADHD coach. You have to do it together. It cannot be one single thing. So the magic is, I think, if you do all of them together. It's not just that one thing.
Do you feel that after social media, many more people have come and asked you for an ADHD diagnosis?
Yeah, absolutely. Because I think there's so much more awareness, and I think it's a great thing. Because yes, people may feel, oh, one is over-diagnosing, but I think most medical professionals or mental health professionals are not going to diagnose if it's not there. So while there may be 10 kids who come to me, I may diagnose only 2 with ADHD, but if they hadn't had that awareness that they got from watching a reel on ADHD on Insta, I would probably have not got those 2 also. And I have noticed a lot with women this is happening.
Okay.
Earlier we used to always think that it was more a male disorder, which is, there is evidence to say that. But women always were under the radar, and especially extremely smart women. I remember that there was a time when I saw, I think, 5 women with ADHD, and there was a doctor, there was an architect, there was a lawyer, there was a businesswoman, and all in their 40s, because they had read about ADHD or seen something on social media, that they thought that they had ADHD, and they were absolutely correct. Because they were so smart in school, it didn't come up so much. Later on in their 40s, they had a lot of stuff to do. They had so many balls to juggle. It was their kids, it was their husband, it was their work. And they just completely collapsed. So, so that is, I think it's fantastic that people are more aware, and so they get diagnosed, they get treated, and they lead great lives.
So, Doc, you were just talking about the treatment for ADHD. What does that entail?
So again, as I was saying, that being a medical professional, for me, it would be more about medicines. So we have medication which helps people with ADHD. And these medicines, so basically the basic premise is what? That the frontal lobe, this prefrontal cortex as we call it in our brain, is the one which is important for executive functions. What are executive functions? Your memory, your planning, your organization, your focus, your ability to change focus from one thing to another, your impulsiveness, etc. All this is done by this part of your brain. In most of us, the dopamine levels in that part of the brain are normal. In people with ADHD, the dopamine levels are less. So these medicines directly or indirectly increase the dopamine levels in the brain, and therefore you're able to focus well, you're able to, you can not zone out, you remember, etc. because of the dopamine which has gone to normal.
So, there is a lot of conversation on stimulants and non-stimulants, but what do they really mean?
So there are the medicines are two types for ADHD. There are the stimulant medicines and there are the non-stimulant medicines. It's a little funny that the word stimulants is used, because parents, when you use that, say, but he's stimulated enough. Why are you giving him more stuff to stimulate him? So the stimulants act in a different way and the non-stimulants act in a different way. I'm not going to go into the technicalities, but what I can tell you is that the stimulants act immediately.
Okay.
So you take it in the morning, it acts for the day, and however, depending on what type of stimulant you're using, the effect wears out. So by the evening, there is no effect of the stimulant in the body. So the ADHD person goes back to being ADHD by the evening. But in that period of time, has been able to achieve a lot because of the dopamine levels going high. The non-stimulants are medicines which you take, which will take 6 to 8 weeks to stay in your system, increase the levels of neurotransmitters in your brain, and would act then. But they would then be acting all the time. So you won't have a dip in the evening when the medicine like the stimulant wears out. It will act all the time. We usually use stimulants as the first plan of action, unless there are some side effects which are there with the medication.
So what would be some of the side effects?
So the side effects of the stimulants, there are mainly two. One is that appetite loss happens.
Okay.
So I always tell a patient to have a good breakfast if they're taking the long-acting medicine, because then the breakfast is good, then the lunch, even if it's not good, the dinner makes up for the calorie content for the whole day. And the other thing is sleep issues. So you usually don't take the medicine after around, say, 4 o'clock in the evening. Because a lot of ADHD people anyway have sleep issues because their brain is so wired. Right. So sleep can be a challenge. So those are the main side effects of the medication. Then sometimes people feel anxiety, as I had said earlier, with the medicine. Sometimes you may feel a little low initially when you take it, but then that settles down. So usually, most of the time, these are safe medicines to take. And in adults, we do say that do your BP or pulse on a regular basis, especially when you increase the dosage, because sometimes pulse and BP can get high with the medication.
Do you feel that everybody does need medication for ADHD? How do you decide who should and should not?
Okay, so rule of thumb is that for any psychiatric illness, as long as your functioning is not affected and you have a diagnosis, you cannot be diagnosed with a psychiatric illness unless you have a your functioning is affected, which in children would be they're not able to perform well in school, or they're getting into lots of fights with other kids. And in adults, it would be now work performance, relationship issues, etc. So if that is happening and it is at the point where you don't have enough time to do ADHD coaching, or you don't have enough time for therapy, and you need the person to get the dopamine levels high quickly. Like, the school is saying that I'm going to throw this kid out of school because he's just behaving really badly. Or there may be a husband and wife having a lot of issues, and they are on the verge of divorce, and the divorce reason is because the wife is not able to get her act together because of her ADHD. So then I would definitely look at giving medication. But unfortunately, some people don't respond to it. So you may then change from the stimulant to the non-stimulant.
Do you feel that over the years, acceptance towards medication for ADHD has changed?
I think to some extent, not a lot, because people are still very wary of giving medicines. And I think in our Indian context, probably people feel that, in our Indian context, a lot of people feel that psychiatric medicines make you sleep too much, you're a zombie, you forget things. It's bad because, and I think it is because most psychiatric illnesses were all called one thing, which was depression. And so even if it was a very serious illness like schizophrenia, people would say, okay, this person has depression, and look at him, he's now really a zombie and he's not being able to function, etc. So they just carry it forward to every illness. So you still I still have a tough time convincing people who are on the edge kind of thing. If it is a parent who comes with their child who's been threatened to being thrown out of school, they will be okay with starting the meds. But if it is a family where the child is not performing as well as they would like to, they may perhaps say that, no, we don't want to do medicines because of all these reasons. So psychoeducation is a huge part of the work which I do. To educate patients about the illness and about the medication and how they act and what we do and how we monitor, etc.
Do you feel that your role in educating others on this has become less over the last few years?
The reason why it has become less is because, yes, people read about it. So they will say, okay, so doc, what about this side effect? Does this happen? Like earlier, there used to be this thing with children that their growth gets affected by medication, which has been completely dissed now. So they will have read it and they will say, what about this? Another thing is, which has helped me a lot, are all, again, as I was saying earlier, all these beautiful therapists who have already prepared the patient before they come to me. So then it is not difficult because the convincing has been done by the therapist and I am just the medium to give them the medication.
Doc, thank you so much for all that information. We're now going to go into a little fun segment where I would like you to share I'll share some sentences and you can share if it's true, false, grey area, whatever comes to your mind when I say.
All right, I have to be alert now.
Okay, so in the Indian context, meds are addictive.
No, actually meds are not addictive. In fact, whatever studies have shown that people become addicted to substances if you don't treat the ADHD. So medicine per se is not addictive in ADHD.
It's a Western thing.
I mean, disorders, humans, brains, whether it's West, East, North, South, are all the same. I think it's probably, I feel we look at it from the Western thing because we are all influenced by the Western environment, right? Whether it's diseases, whether it's clothes, whether it's movies, etc. So people think that. But it is as prevalent here as it is in the West.
So it's more a human thing than a
Yes,
West
definitely a human thing.
only kids should be on meds.
In fact, again, that is false
Huh.
because one has noticed, as I was saying earlier also, that medicines, ADHD is something which lasts your lifetime. So whether it's a child or an adult, medication would help either of them. So whether you are a child with ADHD or you are a mom with ADHD or you are a CEO with ADHD, everyone can benefit from medication.
So it's not bad, it's great, it can help you.
It can help you, yes. And often also, I think in this context, I would say that sometimes people feel that, oh God, I'll be on the medication for life. It's not necessary. Because you could take it for a while, get used to, your brain then gets rewired in a way where I sit at my desk and I focus. I don't look at all the other emails. I only look at the mails that I have to. So over a period of a few months and all, you get used to sitting and doing your work. So even if you remove the medicine, there is a huge chance that you will continue that. But you would need that medicine to help you in that context.
So you use the medication to actually be in a mental space where you can build your skills, and like you said, pills and skills have to go hand in hand.
Absolutely, absolutely.
So my next statement, which I think we've got an answer to now already, is if you need pills now, you'll need it forever.
No, it's completely a false thing because some do. I'm not saying that everyone doesn't, but some people can be taking the pills for a short period of time to get their brain gets a little wired in a different way. So you get used to being able to sit still and do your work instead of taking or starting to play a game, etc. And then maybe even when the medication is withdrawn, you're able to focus. So, and also what I've noticed is that often what helps is that, especially the kids who I see during their school years, they've been taking their medicines very regularly and then they stop it. And then they come back as young adults when they have to do a GMAT exam or a law entrance exam that, doc, I need this to focus. So they would take it for that 3-month period when they need it really a lot, and then they would not take it at all because they have developed interests in a particular thing. When you're in school, you have to do subjects which you hate. But when you go to college and when you decide your career, you may be doing something which you love. Like you can be an actor, you can be an artist, you can do something different which automatically increases your dopamine in the brain. So you don't need the medication to increase the dopamine.
It's interesting that you say this because one common pattern that shows up with a lot of adults with ADHD is that, we worked in place A or industry A for a year and a half, and then they switch jobs and they keep switching jobs until one day they find really what they love doing, and then they can stick on for years.
Absolutely, because they just their dopamine levels are good without having to be able, without having something like a medication to help them. You see that even with ADHD, one of the things it's not just a problem with focus, it's a problem with hyperfocus. They hyperfocus on certain things which they enjoy, and why is that happening? Because the dopamine levels get increased when they are doing something which they enjoy.
And so they forget
everything
else.
Yes, they forget to fetch their child from school.
So socializing in ADHD is a big thing, right? What are your thoughts on
Absolutely, because people get, ADHD in adults, especially in social situations, they're very impulsive, right? So they may say stupid things, they may say inappropriate things, they may sometimes zone out, so the person who's sitting with them and talking to them realizes, oh God, how rude is this person who's not interacting with me? They may be fidgety. So there are social situations also are sometimes challenging for ADHD adults. And they have probably learned from the time they were kids that people do ostracize them, or people don't really talk much to them, and those things also stay with them. So then socialization becomes more difficult for them.
Do you end up also educating a lot of partners that come with the client?
Yeah. Yeah, you have to, right? Because you have to also talk about the fact that the intent is not to forget. The intent is not to not finish the task. It's just that I got so busy with my work, with my canvas, that I forgot that I had to rush to school to fetch my daughter because her exams were finishing early today. So if the family understands that the intention is not, it's not that you want to do this, it just is a part of your brain.
And so creating systems that
Would help for both, right?
Okay, so Doc, our last segment is a rapid fire.
Oh,
So
I hate those.
the first thing that comes to your mind when I say your go-to metaphor for explaining ADHD to your patients.
ADHD is not a life sentence.
That's really powerful. A funny instance which involves ADHD medication.
Oh, I had a case of a father taking his son's medicine and then coming to me and saying, "Hey doc, even I think I need it."
Oh wow. What is a word that comes to your mind when I say ADHD and Indian households?
Lazy.
Oh, that's a common one.
Yeah.
One side effect that people don't talk about enough.
I think relationships get really affected in ADHD. Whether it's parent-child, whether it's husband-wife, partners, work issues. So these relationships are very important to be addressed.
I know it's rapid fire, but I have to ask. So, what is one thing that caregivers or partners should do?
Understanding the disorder, because if you understand what challenges a person with ADHD faces, you're able to understand that this is not done intentionally and it is something which happens.
A non-med thing that helps with ADHD.
Reducing screen time, reducing usage of gadgets.
So I guess across all age groups, right?
Absolutely, absolutely.
Doc, thank you so much for your time. Any last thoughts before we wrap?
I think just for everyone to understand that ADHD, as I said earlier, is not a life sentence. You can lead an absolutely wonderful, well-rounded life in spite of having ADHD with the right kind of interventions.
Thank you, Doc. I think that's so powerful, right? Because even with a lot of my clients, I end up seeing that their careers are going well. They have good relationships. So you can actually have a really, really good life. And you have to put in a little extra effort to maintain it, but it's possible.
Absolutely. I think so. I absolutely think so. And also ADHD people bring so much, such different things to the table, right? Their creativity, their fun, their thinking out of the box. It's fun. I have always enjoyed talking to my patients who have ADHD.
Thank you, you're right, because we don't talk enough about the positive side of it. It's always a challenge.
Yes, that's true.
So thank you so much once again for being here and for sharing your experience and your expertise so authentically. Thank you.
Thank you, Ankita. It was a real pleasure to be on this podcast. Thank you.
Some of the things that were really impactful for me were, I think, pills not being a replacement for skills, but actually pills helping you build the right skills. The second one definitely was ADHD is not a life sentence. It can absolutely be managed. And we often hear about men getting diagnosed with ADHD or boys getting diagnosed with ADHD, but it's not just a male disorder. It's so prevalent and seen in women as well. And lastly, social media. It's always talked about or often talked about in a very negative light, but it can really be so positive in terms of the awareness we get from it. So I can go on and on, but I think I'm going to stop here. A big thank you to you, Dr. Pervin. You've really shared a lot of good insights and information with us.
Thank you.
So if you've ever felt misunderstood or unsure about ADHD in your own life, well, I hope this conversation has brought you some clarity and also some comfort.